Yeah, my name's Ivan. I am a member of Community Action over in Washington County.
So glad you're here, Ivan. That's awesome.
Yeah, thank you for having me today as well.
Yes, Ivan, thanks for joining. And we're going to ask everybody to go ahead and put their first name or first and last name and then the organization just to help connect. This is a community thing, so we're looking to link folks here. There you go. I think Dina was sharing a little bit earlier. Hi.
Hi.
Welcome, Dina.
Thank you. My computer looks like it's lagging a little bit.
All right. Who are you with, Dina?
I'm with Transcending Hope Recovery Homes.
Awesome.
Love it.
Thanks for your work. Thanks for your service. It's so important. And then Karen, nice to see you, Karen. Welcome.
And Nicole. I'm still learning how to navigate this so that I could see people, but I love that you taught us, Ron, to click on participants and we could see a list of who's all here.
Yeah, this is we have about 50 signed up for this first session. And so this is kind of a gathering time. We're just sort of welcoming people in the door, especially those who showed up a little early. Little case study showing on the pre-roll, and inviting people to just say hey and who they're with. See, there's Nicole.
Yeah.
Good to see you, Nicole. There's the new narrative, and I got your name of your organization in your Zoom name.
Hi, Katie. Hi, Pedro.
Looks like they're still connecting to audio.
Oh, yeah.
And by the way, as people are gathering here, just a quick note, if in the upper right-hand corner of your Zoom screen, if you're not already familiar with it, if you hover over just under the X, don't hit the X in the upper right-hand corner or else we'll go away. But if you hover under it, it has a view option in most screens, depending on your version. You click on view, you're given a choice between standard side-by-side speaker or side-by-side gallery. We'll encourage you to go side-by-side speaker as we're going to be using Spotlight through the presentation today. And then you can toggle between being able to see everybody and being able to focus on the speaker. So again, upper right hand, click on the view, drop down, and you can manage your interface. Who else do we have joining?
Got Corey from Icon 3D Signs. Good to see you, buddy.
Great to be here.
Super great to see you, Corey. I was actually just at your place yesterday. You did a sign for the Bybee Lakes Victory Garden with Vet Rest. Thank you so much, sir.
Woo-hoo.
It is so my pleasure, and I'm sorry that I missed you.
No worries. I love seeing a downtown small business like Icon 3D leaning into it and keeping the doors going and rolling. And I was able to peek into your space there. Looks like you got a lot of good projects happening.
Can't wait to give you an official tour.
Hey, so people are already starting to put their welcomes in the chat. Please keep doing it. Like, who are you? Who are you with? How do we reach you? Are you for-profit, non-profit, a government entity? Just throw it in the chat. This is a good time to get to know each other.
Indeed. And in fact, the chat's going to be saved and shared, as well as this meeting's being recorded. This is about gathering community, optimizing our resources, and genuinely making a difference together. So go ahead, use that chat and open up this little open mic time. We're going to be starting in about just over 4 minutes or so. Introduce yourself. Who are you with? Just it's a good time to say hey, and if you would like to share your video, this is a great time to let people know who you are and some of what you do. There's Wade McJacobs. Recognize that guy. How you doing?
Thank you. How are you, Ron?
Great.
Good.
How's the book ops?
The book just came out in April and it's doing very well. Now
Awesome.
I'm starting to look for places to create the class to offer through the books.
Yeah, maybe share with folks. He does a great writing, working with youth. You want to share with folks the name of your book?
The book is called Dare to Read, and it is a book that helps people that are struggling with their reading skills. And I'm also finding that people who are learning English as a second language could benefit from it, but it takes a positive approach that is not struggling, and it's actually fun. It uses something called mindful reading to help people be alert to the mental images that they are creating while they're reading, rather than struggling with the reading.
That is an amazing community resource, and that's what this is about. So please share your info in the chat. Any other folks on just say hello and kind of what they do as we gather a few minutes here before the official start? See some other familiar faces jumping in. See, there's Betsy, Kaylee, and Brendan. There's Miso's in the house. How are things at Miso?
So what?
Hi, I'm here. Yes. Yeah, hi, my name is Shikha Goel and I'm from Miso. Miso, things are really great. Things are opening up as vaccine is rolled in. So we are very busy and hoping for everyone else too. Yeah.
Great. Hopefully Nita's well as well.
Nita's doing great. Sorry that my video is off. But yeah, Nita's doing great. Yes, she is.
Awesome.
She comes and visit us all the time. So that's the nice thing.
Thank you for joining.
Okay. Thank you.
Awesome. Any other folks want to just say hello? And if you haven't already, put your name and then your organization in your Zoom name. If you hover over your image and then click on the ellipse, the 3 dots, that'll give you an option to rename. You can rename yourself, putting your name and then your organizations in brackets as I've done. And so we get ready to kick off the program here in just a little bit.
Hey, Katie, it's so awesome to see the library with us.
All right, we're going to get going in just a bit. If you haven't already, we'd encourage you to turn on your video. This is meant to be a community gathering time. We're going to be optimizing resources and making a difference together. With that, I'm going to turn it over to Brenda. Take it away.
Hey, good afternoon, everybody. I'm so excited. I just all caught up in the chat right now saying hi to people, and I'm thrilled to see such diversity in the room here. And I wish I could see all of your faces. I apologize. I can only see the screen and a little bit of the chat here and there. You might have that same experience. Please feel free to turn the chat on. It's at the bottom of your screen, a little box with a chat icon. Just click on that. And tell us your name, the organization you're with, and then how to reach you if you want other businesses in this forum today to know who you are and how to connect with you so that you can partner together business to business. It's also helpful if we know if you're a for-profit or a nonprofit organization. Some of the folks in the room today are people who offer contracting opportunities and are just trying to get an idea of who's all in the room. So we really encourage people to do that. If we were in person, I'd be talking about housekeeping things like where the coffee is, where the water is, what's down the hall. But today we're just going to talk about some quick housekeeping around navigating our space. So please use the chat. This is meant to be an interactive forum. Ask questions in the chat anytime and all the time. This is for you. Please feel free to download the chat so that you have those conversation pieces, but also so you know who's all in the room and how to reach each other, because you're a community together during this forum and always. So we really want to encourage people to do that. Throughout our conversation today, things are going to maybe feel like they're going a little bit fast at times. You'll be hearing some new information. Some of it will be, aha, right? And some of it you might want to hear again. So this video is, or this forum rather, is being recorded and will be available to you if you'd like to see that on Best HQ's website. Best HQ is our event host today, and we're very thankful for them and the great work that they've done in pulling all this together. So we'll super quick, I'll let you know what's coming up here. We're going to just continue to say good afternoon, get connected, put your name, your contact information in the chat there, get to know each other a little bit in the chat. And then I'm going to introduce, in about 2 minutes, I'm going to introduce you to our keynote speaker today, who's going to really just kind of walk us through a PowerPoint presentation about what is this community resource network thing and how does it work and how do I fit into that? So I want to encourage you to stay tuned for that. And after that presentation, we'll probably hear some testimony or lived experience in being able to access the system and what some of those outcomes have been in other parts of the state. And then we'll do some Q&A together. I'll give you an opportunity to just kind of check in really fast before the Q&A in case folks have to leave for whatever reason, so you know what the next steps are. Then we'll do question and answer before we wrap up and just kind of revisit what happens now. So I can't see your faces yet. I will in a minute, but I'm watching the chat. Still looks like we have lots of people joining us, which is awesome. So I mentioned that we'll have someone be with us today as our keynote speaker, just really kicking us off and walking us through a PowerPoint presentation. We're really fortunate that that person is Tim Sinatra. Tim Sinatra is the CEO for the YMCA in Marion and Polk counties. Tim is also a community leader in various pockets across Oregon and well known throughout the nation in the work that he does, coordinating systems and aligning them to create or expand impact throughout our community. So Tim, thank you so much for being here. I know that you're kind of the visionary behind all of this, if I remember correctly. So tell us all about the Community Resource Network.
Thank you. Thank you. That's Brenda, it's always great working with you. I'm going to share my screen real quick. And everyone see the PowerPoint? Brenda, can you see it?
Yes, Tim.
Yeah, I can.
Excellent. Well, welcome everybody. It is delightful to see the attendance here today. This really started with a dream and really a desire. One of my greatest passions was always about the potential I feel every community already has. I believe communities have potential that exists, and really, how do we untap that? How do we mobilize it? How do we center it in such a way that it can create really great results, goodwill for everyone, especially those who need us the most. So thank you all for attending. My name is Tim Sinatra. I've spent 29 years in the nonprofit sector. Good portion of that with Boys and Girls Clubs of America. I spent 3 years with the Department of Human Services, where I got to meet Brenda Pearson, who I think is just a superstar in also thinking about a multi-sector approach in communities connecting to meet the greater needs. So thank you for being here. We're going to give you a quick overview of Community Resource Network, and any of us would be happy to follow up with you and share more about the potential that exists in developing these networks and how easy they are to get up and running. So thank you for going. We're going to start here with why the CRN came about. So in 2005, I was in Charlottesville, Virginia, as the executive director for Boys and Girls Club. And I bet you all of you can kind of recognize a meeting like this, where you go to a community meeting and there's always that conversation, if only the state gave us more money, or if only the philanthropist gave us an extra $1 million, we could do this, we could do that, if only, if only. And I kind of started to get frustrated with those meetings because it seemed like nothing was ever moving, and yet we had these smart, bright people sitting in the room. And I thought, well, what's the disconnect that we're always waiting for someone else to solve it for us? There must be a way that we can collectively come together and figure out how to meet real-time needs in the moment and work in a collective fashion that creates great results that aren't just short-term, but are long-term and sustainable. So that's where the CRN came about. And I started to think about, well, what can we do where we can tap the potential that already exists? And so what we did was developed a quick website and got a bunch of people on there from a multi-sector approach and started listing some needs just from some basic information. And there it went. And that was pretty archaic at the time. And then ran into a gentleman by the name of Wasi Khan, who I think is just brilliant, and said, Tim, I can build a platform much better, much powerful, much faster, much cheaper, that can do exactly what you want to do and make it easy for everyone to create impact. And I said, you have my ear. And there was the first iteration that we'll see later, Marion County, and then the Eastern Oregon Resource Network. So I want to continue on to talk a little bit more about what the CRN's purpose is. I always said a great community, if they are successful, it's only 2 calls back in the day when we used the phone more than the computers, 2 phone calls to success, or 2 clicks to success. And that means you have an interconnected community that utilize those strengths that can respond in the moment and over long term. But when you boil down what's the core of CRN, it's really about firming up safety nets and expanding opportunities. And you do that through really looking at, well, who's in our community? Who's in there from businesses, public, private, retirees? People have many options and opportunities to give, but sometimes it's hard for them to connect with what is it they can do? How can they? And yet they don't want to be overwhelmed with people always coming to the doors asking to help. And so many times you'll see a lot of people afraid to help. It's just like donors. Once they give once, they know you're on the donor list, and they get every ask for the next year from your organization, and it overwhelms them. So we said we've got to make it so it doesn't overwhelm, fatigue any of the participants, and make it very much from a strength-based approach. And so that's where the multi-sector came about, and really connecting the multi-sector to address social priorities from a strength-based approach. And that's really, when you boil down the CRN purpose, that's really the evolution of what we were trying to get to. And we've achieved that today in the 2 other pilots here in Oregon. So these are two concepts from my experience in communities that I think many of you would probably agree with. There is no one system that can really serve every resident in every community. I remember working for DHS, Brenda would remember this, where we'd go into communities and you'd always hear someone say, those are DHS kids or those are DHS families. And I would say, no, they're not. Those are your neighbors, your friends, your coworkers. This is your community. We as a community should be able to help support the really future and the challenges and the opportunities together collectively and not depend on one system or one entity to do it. I've never seen one organization able to truly meet the needs. And then the other concept that I think is important from the community level viewpoint is that shared outcomes. You'll see many times where our strong economies, really doing well, and everyone starts to think things are great, but there's always an underlying group in every community that aren't experiencing those wins or those benefits. And I think this allows us to really make sure that once the CRN is fully operational, that you can really make sure that all of the needs of people who we come across and we can help can get those needs, whether it's in a down economy, an up economy, or it's during a pandemic. The CRN, as we were looking at the CRN as a tool to address crises, from the fires in the canyon to also be looking at the pandemic approach of how can we make it safe to still meet needs when people aren't coming to your doors anymore. So the CRN began with trying to answer some of these questions. What happens when service referrals are not met? We actually started this because when the referral system started out there, we were finding many people were getting referrals, but the need still wasn't getting met. Now, many of the referrals led to great success and so on, but we started to say, well, what happens when the referrals fail, when that child or that parent or that family doesn't get their need met? And so we built this CRN at that time to be a backup to the referral system so that we could help with that. Where can you access community level data to inform your organization with decisions? How do you share your organizational strengths? How do you let people know that, hey, we have this to offer? If a resource or an event is there and you've got all this great amounts of community partners coming to your health fair or something like that, how do you get the word out through the partners without having to make a bunch of phone calls, or you might not have their emails and so on? And then what was most important was you'll find many times people will have a need, but many constraints on nonprofits or even with public services, well, we got to wait to the next community partner meeting or to the board meets or to the quarterly meeting. And people don't have the luxury when there's some basic needs that need to be met that they can wait another week or 2 weeks or 3 weeks for some authority body to approve it. And we said, why couldn't we just meet it in the moment? Let's help to create something that can meet these needs in the moment with the sense of urgency and support behind it. So what the CRN does do, which I'm very proud of, and we're watching that right now in the maturing of the 2 pilots, is everyone knows a lot about adverse childhood experiences, and you can see the paravases, the above the ground kind of symptoms that happen, then below the ground, those systemic types of things that really create what you see in our kids, from child abuse, incarceration. You see all the different types of stuff that happens with homelessness and so on. And you say, well, what's in the roots that we need to also go after to create these supportive community environments? And the CRN really helps with addressing both of the paravases, the below the ground and above the ground. And you can see kind of from a child point of view, supportive childhood experiences and what a beautiful, growing, thriving tree looks like. And the CRN helps with all of those, every piece of it. In any community, you could probably look at needs and break them into really 3 zones. Universal supports, which is really 80% of needs that are out there. And they're usually the urgent or just out of the gate needs before they start to become specialized or intensive. The higher you are in the pyramid, the more expensive it is, and the harder it is to meet that need because it becomes very complex. But what if we could create a platform like the CRN that can get in front of that, get to the universal supports where we can share them at such a rate and from a strength-based approach that we could get in front of many of these things from a prevention and asset building perspective versus a responsive reactive intervention approach. And that's what the CRN does. It actually operates in all the areas from universal supports to specialized and the intensive, but it really helps focus on the front end of that prevention and asset building too, by really getting everyone on board to the platform and everybody just doing something to help out. As we look at the focus areas of the CRN, one of the main goals and objectives for the CRN to be productive and successful, it's about enhancing connectivity. That's really getting everyone on board and really everyone saying, all right, from a population outcomes, whether it's at the neighborhood, the block level, or the city or county level, what are our key priorities and how can we utilize the potential that already exists there to create not short, but long-term collaborative relationships that aren't there just because a grant funded us to be there, but it's there because that's the right thing to do. And if we stay there and we operate collectively together, we can actually move on many of these opportunities and challenges and see great results. And that leads into, once you're connected, you look for alignment opportunities, you look for intersections, you look for priorities that are crossing over and how we can layer together to get side by side, shoulder to shoulder, to make really some great progress on this, but keeping the diversity, equity, inclusion lens out in front in our decision making and our strategy development. And then also building capacity. I think for me, whenever I start something as a nonprofit leader, I plan to start it in such a way that we will be there until we're no longer needed. So we're always looking at the long-term sustainability. And if you consider finances as your sustainable measure, you know funding comes and goes. You know that sometimes the grants are there or the donor's there, but maybe they move. So you can't always depend on finances as guaranteeing long-term sustainability, but you can depend on everyone coming together to do just a little from a strength-based approach. And when you think of it, a lot of a little is still a lot. And that's one of the goals of the CRN. So as we think about building resiliency to address both opportunities and to address our greatest challenges in each of our communities, we want to utilize private sector innovation, leverage the public sector resources, and then mobilize the social sector networks. And that's what the CRN is all about. So let me give you a quick example of how this works. This is a real-time story. So I had it was early in the morning one time. I was walking to my office around 6:30 a.m. at the Boys and Girls Club. And I hear some footsteps coming up behind me pretty quickly. And that's pretty early because usually nobody's around that early. And I look behind me and this older gentleman asked me, he said, "Do you help children?" And I said, "I do. What type of help are you looking for?" And after we sat down and learned about his needs, he had a young girl and the mother who was living with them. They came from China. He was supporting them, but she had an abscessed tooth and they didn't have insurance. So they were referred to 3 different places, and every place they went, halfway through signing into the process, they said, "Unfortunately, we can't help you, go here. Unfortunately, we can't help you, go here." Until finally he said, "I don't know where else to go. Nobody can help us." And luckily the Boys and Girls Club, through a collective approach, had a dental operatory center with 23 private dentists who donated 1 day a month to come do free dentistry for whatever kids needed. And we were able to meet the needs, but that was by chance. And what CRN does is says, let's take chance out of it and let's make impact a choice by coming together and getting all the resources where we can load up a ticket, send it out, and within seconds get commitment to doing something for that child. And that child was taken care of the very next day. And basically, when we're talking about the essence of the infrastructure of CRN, it's really, if you look at the left part of the slide, you see Community Resource Network, get everybody on board, then say, well, what are you the best at? What are you passionate about? And then start to mobilize that potential and use technology to make it easy. so that you're not spammed to death with 100 requests every day. You only get what's coming to you based on the profile you set up and the interest and the strength you can provide. So you may only see 3 things you can help out with a month sometimes. Sometimes you'll see more, it just depends. But it's a great resource so that when you do see it, you know, I need to help. I need to step in if this request came to me. And if you can, great. If you can't, you can't. Maybe there's something that holds you back from that time. The other thing we do is we bring everyone together quarterly. Usually that could be now with Zoom and technology. It could be via Zoom or in person, where we look at where's the frequency and the types of requests that are coming. Because if we're getting repeating requests in certain neighborhoods, like an after-school program request, and there's nothing there, then you set up a mini little task force team that goes in there and really assesses everything, and then tries to mobilize an organization and support that organization to go set something up right in that community. So it's both immediate needs, but it also addresses long-term needs from a collective impact approach. And this just looks at taking the community convening platform of the CRN, sharing the data so you know the real-time issues going on, and then connecting program performance, meaning nonprofits, public, and even the private companies with population outcomes, and being intentional about creating a community dashboard that we can always see where we are as an organization. And this gives you, I won't go through each part of it, but basically you start with a need that you are trying to meet in your community. You're having trouble with it. You may have a referral, but still not working out. You load up a ticket. It goes into the platform. There is a human who looks at it to clear out any personal information that might be there. So it's just on the basic need. It gets shot out to everyone on the CRN who have a profile related to that strength or need. And then once people step up for that, they coordinate the effort and have a quick timeline to getting that need met. Sometimes it can be that day, within hours, or it might take up to weeks depending on what it is. But you know at least action has been taken. So one client, one community. We talked about this, the quarterly platform. Usually it's coming together for an hour and a half. That's it, to keep people connected. We really celebrate the successes, look at the data, and if we have to mobilize task force after any things that are trending or concern, and we make sure that we activate frequently on things that just keep reoccurring. We just don't accept that we're meeting the same needs over and over. We want to say, what's the root cause of this? And how can we really take action from even a more complex type of issue? Community benefits, you can see those there. Usually there's no cost for the members. We created, there's usually a sponsoring agency who will step up as the backbone agency, and we usually try to find funding so that there's no barriers to any organization or partner coming on to that. And it really helps accelerate the supportive community environments that everyone would like to see, and protects the client's health information and personal identifying information. And in that, it becomes a great tool because many communities already have like teams that are set up to address complex issues at the neighborhood level or at the agency level and so on. And the Community Resource Network becomes one other major tool in the toolbox to create the thriving communities that are addressing education, employment, health, nutrition, housing, and public safety. There's 2 pilots going on. You can see this is the Marion County, 250 active members, 140 organizations. You can see the breakdown of it. Backbone coordinating entity is Marion County. It was established in 2017. The next one, we're really excited, just got going in October 2020, already 132 members, 62 organizations, 3 counties are working together. This isn't just one, they're actually, the 3 counties are supporting each other, and Building Healthy Families is the backbone coordinating organization for that. So I'm gonna stop and just thank you all, for what you do, for being here, and being willing to learn more about this opportunity. I will stop sharing.
Hey, Tim, don't stop sharing too soon because we have questions for you. So I just am overjoyed every time I see this presentation. I can never get enough. Something that comes to my mind is that I know that there are testimonials out there. I know there are people, even on this call today, who've actually experienced the Community Resource Network, where it's being piloted in Eastern Oregon and in Marion County. Can we hear just some testimony from folks who have used the CRN and give an example of where you've seen impact in the community?
Looks like Amy's raising her hand.
Hey, Amy.
Hey, Brenda. I wanted to share one of our success stories with you. It's about a woman who was going through a self-sufficiency program, and she needed the money to get the fingerprinting for her licensure. And she didn't have it in her budget, and they looked at all of these other resources to try to come up with the money. It was $64.50. And it was uploaded to the CRN, and within minutes, I believe, that request had multiple people saying, I want to pay that fee, I'll pay that fee. And so she was able to get her licensure and become a CNA.
Okay, Amy, I have some questions for you. Was there any identifiable information?
No.
Like, did we know it was a woman? Did we know anything about her?
We knew it was a woman, and that was about all we knew. We didn't know, and that she was involved with the self-sufficiency program, but we didn't know any other personally identifying information about the client.
Did you load any of that information into the CRN? So did any of the partners who were members in the CRN know that it was a woman or that she was involved with self-sufficiency?
They did know that. That was part of the story that was told as part of uploading. You want to tell a little bit about the client, so there's people in the community know what they're helping for. But we don't include any personally identifying information, so nothing that would be able to recognize her.
Yeah, the generous folks who stepped up to help out and said, hey, I want to answer that need. Did they contact that woman personally or give her money?
They contacted the caseworker and worked through the caseworker to be able to fulfill that need.
I love this. Could another community member have brought that need forward? Could it be Community Action Agency, who's with us today? Could they
Absolutely.
have submitted it? Okay. And then the money
Absolutely.
would go to Community Action Agency, who would then make sure that the fingerprinting was paid for, right?
Yeah.
Perfect.
Brenda, think about what Amy said. You have someone who's got self-sufficiency support from the state,
right?
Making great progress, has done all the homework to get this great nursing occupation where they're gonna do, pretty well and maybe even serve on a nonprofit board, but $64 is holding them back.
Yeah.
And those are the types of things that a community could step up and nullify within seconds if people just know about it, And how many, Amy, a question, how many people from what you could tell were like asking, was there a lot of people saying, I got it, or how did that
Yeah,
work?
there were multiple responses. We don't know how many there were exactly, but there were definitely multiple responses. And when you close your ticket on the CRN, you upload, you write a little thank you note. And the thank you note for this one said, thank you to everyone who's wanted to support this. We found a donor. And so there were multiple people that stepped up.
That's awesome. Thank you so much. I wanted to acknowledge, I saw in the chat, Wade had made a comment and he said, been doing this for 40 years. Before there were computers, being able to answer those needs. And I honor that 110%. I've been around the state system and local government and the nonprofit arena for 26 years now. And that's how we always did it. We do business word of mouth in Oregon. And I love that this system connects private sector, public sector, for-profit, nonprofit, every industry, whether it's health, human services, construction, cleaning and repair, IT, graphic design, everybody's there. I saw a request in the Eastern Oregon CRN for art supplies met like that.
Yep.
How amazing. Just, hey, we have a young person who needs some art supplies. Anybody can help, and boom, it was met. Any other testimonies out there or things that we could know about this?
Brenda, this is Vasi.
Hi,
Can you
Vasi.
hear me? Yeah, this is, I have a personal example. Recently, Arches had posted a request. They had worked with a family and they were able to get the rental assistance to get the family in a home, but they couldn't come up with the fund to get the furniture or the dinnerware or anything else that is needed to make that basically to furnish the home and get all the things which are needed. The same day, my friend was moving from Oregon and he had very good furniture and pretty much everything was there in his house, and he was going overseas. So he was actually going to spend the money to rent a U-Haul, find the time to take everything, get it to like a Goodwill or another location. And all this he was trying to do at the 11th hour before getting to Portland and then flying out. And so the request I had seen from Arches in the morning, and I happened to see him in the afternoon. Arches was able to coordinate with him, arrange for the transportation, and the same evening they were able to get everything what was needed by the family the same day. And the best thing was it also helped the person who donated all those items, because that saved the person a lot of time.
Wow.
While he was getting ready to fly overseas.
Yeah, so they didn't have to go buy furniture or
Nothing, absolutely nothing. He had every single thing in the house. It's like going to something like an open house or a state sale, and then instead of moving the house, you move the person into the house. So it was an amazing experience for me.
Fantastic. Can I ask a question, Tim Sinatra? Is it difficult for people to sign up to be a community member in the system?
Not at all. That was the key when I talked to Wasi, and I said, Wasi, here's this platform for Virginia. And he said, I can make it much better. I said, here's the thing it has to have. And Wasi never forgot that. I said, nonprofit and even, business and public sector, everyone's so busy. And they got emails, they got, backlog of work. We've got to be able to host things, sign up, post something within minutes. And so everything was like, let's be able to lean it up in such a way where we can do things in 2 to 3 minutes and get things just locked in, so that you never feel like, oh my gosh, I got a half hour of questions to go through to log up something, whether to become a member or to even log a request. And it's literally done in minutes. And Wasi has, I would say, perfected not just the registration, but also the logging and the response to respond to help out with the need to make it so effective, so efficient.
I love that very much. So if people, our next steps, I kind of want to hear some question and answer from our audience. And before we lose anybody, because I see the time right here, I want to make sure that people know kind of just real quick before we dive into Q&A, and we'll talk about this more in a moment. But if people are interested in learning more.
Hey, Brenda.
Yeah.
I'm sorry to interrupt, but your headphones are clicking out a little bit.
Can you hear me better now?
Yes.
Thank you for letting me know that. Sometimes I move around a lot when I talk because I talk with my hands all the time. I appreciate you letting me know. Hey, so before we move into question and answer real quick, I want to let people know, if you're interested in learning more about the Community Resource Network in Washington County, Clackamas, Multnomah, that tri-county area there for PDX, or interested in being on the steering committee that stands it up, or interested in being a backbone organization, any of those things, there's going to be a hyperlink right in the chat, but it's essentially PDX-CRN.org. And if you have questions, you can, it'll be also on that website, info@PDX-CRN.org. Please reach out anytime. I know these folks do an amazing job being responsive and answering questions. So that'll be, oh, I see it right there in the chat. Thanks so much, Tim. Hey, so questions and answers. Wade, I saw you put something in the chat that we've been doing this for a long time. you want to share a little more about that, or does anybody have anything they want to share or questions?
Definitely be oh, there we go. Wait. You're on mute still, Wade.
There we go. I about 40 years ago, I was involved in a community organization where we kept a list of resources available for people to call in. And it was my job to make sure the list was updated. As a volunteer, all I did is get on the phone and make sure everybody's phone numbers were accurate and the information was accurate. So I was not involved in creating the network. I was just involved in making sure the Rolodex, and it literally was a Rolodex. I mean, we're talking little pieces of 3x5 cards. And that we just kept that network going and tried to keep it organized in some fashion. But it was a lot of work, a lot of volunteer hours went into maintaining that because we didn't have the technology we have today. So the fact that you're doing this so efficiently will save a lot of time and trouble.
It's the truth. Thank you so much for sharing that. I think you nailed it when you said, gosh, we've maintained lists, right? We look on all these different websites. We have our own personal lists. We call our friends and they have lists. And something I love about the CRN is it doesn't replace what already exists. It just links it together, right? And then we don't all have to be maintaining lists, right? Any other questions?
It would be great if you listed in the chat, is this something that would be helpful to you? And you can just put yes in the chat, but we're really interested in your feedback based on your community, your neighborhoods, many of the community members you work with. Would this be helpful? And so we're really interested in your feedback on that.
Particularly something that comes to my mind, could you imagine if this was in place last year before the fires? How easy it would be to say, hey, by the way, we need a trailer. We've got 40 horses to move, or all the things, right? Anybody have questions about that? Or
Yeah, James here. I've got a question. On your presentation right at the end, Tim, you had mentioned the list of members, list of organizations. Can you clarify the difference between what is a member, what is an organization?
Sure. So you can have, like when I was running Boys and Girls Club, I may be an organization, but also in my organization, rather than everything having to go through me, I can have my 8 directors on it and they can have their 8, staff members within their ranks on it, so that there's no bottlenecks. So you can have multiple people from an organization, like a school or whatever, on it. And that's what we want to do, is to create this great access and with everyone to be able to get on it. But the organization would be the host organization, Boys and Girls Club, and I might have 10 other members on it from my club.
And there's no cost to them in any capacity to just sign in. Yep.
Zero.
One question we have from Grace here is, what is the timeline for the rollout of the platform in the Tri-County area? Do we have a timeline for the rollout of the event?
They're developing, Amy and Wasi, Tim, please feel free to jump in. But what I understand is it's really based on community need and interest. So all this week and on the 29th, we're hearing from community and forums like this. If you know people that would be interested in this conversation but weren't here today, it's not too late. Go on to PDX-CRN.org and they can sign up for tomorrow afternoon, Wednesday, Thursday afternoon, or on the 29th in the afternoon, and get a little more information. But it really is right now just about collecting information about who's interested, what's that level of interest look like, and then the next step is standing up that steering committee who will drive it moving forward. The system is ready. The system is designed and ready.
And that's correct, Brenda. In Eastern Oregon, we went to the 3 counties and they had large meetings like this, where everybody came around, talked, asked questions. We asked them if they were interested. Everybody said yes. And then we built a steering committee to then go and stand it up. And it can stand up pretty quickly, but this is really more gauging interest to see if this is something, because the platform's ready, it's go ready. It's a matter of getting really the communities and counties bought in that this is something that would be of value.
So Sherry has a question here. Has the backbone organization been identified? So my guess, I would convert that question as who's involved right now in that steering committee?
The steering committee would be set up after these sessions go along. We'll find people who are interested. And then what we do is bring them together. And I think in Eastern Oregon, I think it might have been 10 to 12 different organizations that represented the 3 counties. And then from there, we chose a backbone organization to stand them up and then help support that organization with the funding to help cover their staffing for it, because it really takes 1, maybe 1.5, depending on how big the counties are. And so that will be determined in the future.
Yeah, Ron, got a question, Ron?
Sure. Well, first off, thanks, Tim, Brenda, the whole team. With our part with Best HQ, we're just honored to be part of this whole just sharing of info, and certainly we'll enjoy being part of the next steps. One of the things that we had talked about is hoping maybe a fall kind of rollout or kickoff, assuming there's the interest. One of the things that we put in chat, there's a direct link to the interest form that's on PDX-CRN.org. So you can either go straight to the website or hit that interest form, and we're aggregating all these organizations, all different types that might want to play. And so we're certainly excited about helping to move it forward, assuming there's interest there. So we're aspiring to fall. How's that for an answer for the question?
And I want to just mention one other value proposition aspect from a nonprofit and also DHS. So the caseworkers in child welfare and DHS, when they have a case and they're trying to get wraparound supports, they may be on the phone calling 5, 6 organizations, waiting a day or 2 to get back. And that's just, when you think about all the time and the cost of that, from time to the trauma, a child coming into the system or so on, when all you do is load this up and within seconds you're getting a response. So in Boys and Girls Club, it allowed my staff, when they might be able to serve 5 or 6 kids a day, now they can do 10 to 15. And without being overwhelmed and so on, because they're using technology to accelerate connectivity and impact.
So I do have a question that it's actually not in the script anywhere, so it'll be a loaded question, but it looks, I just genuinely appreciate the optimizing of resources and how we can share in some of our excess to make a difference together. What happens, or is there ever a scenario in which somebody that might have extra strollers or something, that there's this huge need of strollers and they get overwhelmed? And is there any way, if any of the organizations in the system are actually going to get overwhelmed by requests, because we know there's extraordinary need out there? Does that ever happen, or how does that managed?
Wasi, do you want to share with that?
Wasi, you're on mute.
I was on mute. So yeah, Tim, I thought that example you mentioned about when boys and girls had received those backpacks before beginning of the school year. So yeah. I think that would be a great example if you want to mention that, like how that worked out.
When you get abundance of resources and how to share it, I'll give you an example. We got a call one time where a truck was coming through and they said, hey, we have 45,000 brand new Disney DVDs still in the packet. And if you got a place for us to drop them, you can have them. If not, we're going to the next city. And so we got it dropped immediately. But then to have to call out 50 to 100 nonprofits, was almost just too much to do that. But when you can load it up on the on the CRN and say, anybody interested, show up on Saturday and we can give you X amount. I mean, there was like 50 vans loaded up, getting boxes, making it easy to share those resources. And that's one of the things, so you can share resources. It's easy to share resources. And that's one of the profile things. If someone's sharing resources, it'll notify you backpacks, because if you weren't on the CRN, you wouldn't have known that these options are there. And if you check on your profile, alert me when there's a resource comes about. You'll always be in the queue for the things that are out there that people want to share because they have too much in inventory.
So Ron, to just add to what Tim mentioned, when you are submitting a request, you have an option either to ask for something or share something. So you could even share something specific, or you could even mention about an event. So if somebody is doing a code drive and they're giving out codes during winter codes, they can mention that and they can mention where it is happening. If somebody is doing a blood drive, they can mention about that. If somebody is arranging or providing, say, a lunch or like summer meals, they can post those kind of requests as well on CRN.
Outstanding. I'm super excited. Thank you all for joining. Maybe there's some other questions out there. Maybe raise their hand.
Yeah.
I'll pass it back to Brenda.
I just wanted to say that I've been reading the chat a little bit, and there are a couple of great questions in the chat I don't want to be overlooking. So I have to, scroll down just a little bit. Brendan asked a really good question. It says, I'm curious how you see this network interfacing with other efforts statewide around community information exchange and closed loop referral platforms like Connect Oregon, Aunt Bertha, and others. I know I've heard people ask too, like, wait a minute, is this competing with 211 info? And we're saying, no, 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 no. So he said he would ask that question specifically, but there's a bunch of background noise. So who wants to take that and answer it? How are we interfacing with other existing efforts?
April, do you want, I mean, Amy, would you like to start with that? And then I can add on to it.
Sure. The CRN doesn't replace any existing network. It's a supplement to those networks. And so if we would want those other organizations to be members of the CRN, and so that we're providing a platform that is connecting multiple platforms, multiple organizations together. Yeah.
And it also, the closed loop referral systems are so important and valuable, and it doesn't replace that. But the closed loop referral systems are looking at more complex needs, things that might have to do with mental health, and you got to get an appointment, it's 2 weeks from now. Whereas this is, I need clothing, I need food, or something related to a basic need that we can mobilize to help in the moment or short term. But it also looks at long-term reoccurring short-term needs that we look at. But when you come to very high level complex where you need case management and so on, that's where the closed loop referral systems are priceless. And if you take those two tools and put them together, you have the CRN, urgent, immediate, basic needs now, and then you have the complexity of needs. And you need both of them, actually. And I've got plenty of examples where you can't really have one without the other. It's a blending of the platforms coming together.
Yeah, I'm thinking about your pyramid, Tim, in your slide deck, where you're saying, gosh, there's this trajectory that says, if we meet those needs down here at the prevention level, at the building level, at the connecting for thriving level, it sort of mitigates that escalation to the more expensive and complex needs quite often.
And there's a question I see in there, Brenda, says, who are the people submitting tickets of support requests? And it says solely DHS. No, it's anybody on the network can submit a request of need or offer something, a resource to share. So it's everybody.
In the existing networks here in Oregon, in Marin County and in the East counties, Is there any shelf life for a need, or what happens when a need goes like 3 days or 5 days or whatever? How does that work on the system?
That's a great one. So when we first started this in Virginia, we knew there might be, maybe we send a request comes in, but it doesn't get met. And so we actually had kind of, we called it the grade 8. We had 8 people who were connected in that community who could make a call and get almost anything done. And so that immediately got emailed to the grade 8 and it was done. In fact, the other thing we did was we also got a donor to put 10 grand in the pot. So if we could just buy that, the grade 8, who was kind of the executive committee, would just say, well, we'll just buy that stroller. No one picked it up. We'll just buy it. The reality, though, we never used the 10 grand in Virginia because the members of CRN were picking it up each time. And so we had the backup to the backup on top of that.
That's awesome. And that's something that the steering committee and CRN backbone could do. Hi, Wasi.
Hi. Just to add to what Tim said, they have, I think, maybe Tim has brought this idea to even Marion County, because Marion County has done exactly what Tim mentioned. They have worked with, I believe it is CBEL, and they have come up with a pot of money. I think it's around $8,000 or $10,000. And Jackie from CBEL, she is monitoring all the requests very closely on the Marion County side. If a request is not met within that first few days, she has the approval from CBEL to use the funds to go and get the whatever is required. And so that has been working great. They have helped meet so many of the requests, especially for foster families. And based on that, Eastern Oregon is also looking at into doing the same exact thing, where they want to come up with a pot of money. And so they will be monitoring the request, and depending on how they decide to implement it, they will be using that funds to meet those requests. And Amy, if I'm correct, did Grand Ron already give some funding to EOCRN for specifically for this purpose?
Yes, that's correct. Grand Ron Hospital donated, I believe, $5,000 to the EOCRN.
Yeah.
So I think this is a great example of how the community can come up together and come up with small amounts of money. And like Tim mentioned, when a lot of people put the small together, it's still a lot more. And that is enough to meet most of the needs.
Yeah, it's true. I just am mindful of the time. I know we only have a few minutes left. And so before I kind of give those next steps, I just want to do a last call. Any other questions from the audience today?
I just want to say one last thing, Brenda, if I can.
Yeah.
This is not complicated to get started up. This isn't something we're going to talk about for 3 years. You can get this going in about 90 days if the community is ready to do it and you've got enough people. The key in launching the community resource network is having critical mass enough that when a request comes in, there's enough people to meet it, because as soon as you don't meet it, you're not going back to it. So we wait till we get enough partners online, and then we say, all right, turn it on, and then move from there. And then it becomes contagious. More and more people keep wanting to get on because it's made their job and easier, but it's joyful in seeing the impact that these people don't have to wait days and weeks and months. Things are getting met in the moment. So this is not complicated. This isn't one of those things that I've been frustrated for 30 years where you're in meetings for 5 years and nothing happens. That's the whole reason we designed this, is to allow communities to really dictate their own destiny.
Yeah, and steward it. So that kind of gives us our next steps, that intro into the next steps. Thank you very much, Tim. And thank you for the presentation and answering questions today. If people have additional questions, please reach out. Again, it's PDX-CRN.org is the website, and you'll see more of the events there. You're also going to be able to click on the interest form and fill that out and let people know, what is your level of interest? Do you want it to come to town? Are you wanting to be a member in it? Do you want to be part of the steering committee? Just any of those things, but let us know when you click on the interest form there and fill that out. The other thing that I want to mention is it's your network. Like nobody's going to own this. The government doesn't own this. This isn't owned by an agency. My time and Amy's time are in-kind resources donated to this community event. And we do it statewide. Whenever a community contacts us and says there's some interest here, we just all get together. Tim is the same, Wasi is the same. We get together and just donate our time and do what we can to make this possible in communities. So please let us know your level of interest. And the next step then is continuing to have these meetings, building that steering committee, and then moving forward from there. Oh, there's a question. Do you know another organization that should join? Oh, thanks, Ron. Please, if you know other organizations that might be interested in joining, for-profit businesses, nonprofit, everybody needs to be involved here. Tire companies, hotels. Right now, we're still housing people from the fires that were last year in September, right? We need to know who's out there and wants to partner, right? And then also when you're at the table, a business, for-profit or nonprofit, and you're sharing who you are and what you do, others in your community get to know about you. So it is a really terrific opportunity, business to business, to share out what you do so that others can get to know what's available out there and who to reach out to for other activities. Thanks so much, everybody, for your time, for everything that you do. We really, really appreciate you and look forward to connecting soon.
Thanks, everybody. Great job, Brenda. Wasi.
Great job, everybody. Thank you so much.